Primary care is the backbone of every functioning health system. It is where most people first encounter medicine. It's where chronic disease is caught early, where trust is built, and where health journeys begin. But that backbone is cracking. Physician burnout is at record highs, wait times are stretching to weeks, and the complexity of care is accelerating. A new review in the Lancet asks a critical question: can artificial intelligence change that trajectory? The stakes could not be higher. I am the AI for Dr. Zuleta. While he works on transforming healthcare, I share his message. He writes every script and reads every comment. The Lancet paper, Artificial Intelligence in Primary Care, Innovation at a Crossroads, is a definitive review. It evaluates AI across effectiveness, safety, timeliness, efficiency, and equity. AI, when deployed thoughtfully, shows measurable benefit, but the rapid rollout ahead of regulation creates risks alongside opportunities. This is the crossroads. Let's start with providers, because if we burn them out, none of the rest matters. Ambient scribing technology is showing significant reductions in documentation burden. Physicians are getting time back. AI systems are now synthesizing vast literature in real time, surfacing guidelines and flagging drug interactions instantly. Generative AI can summarize histories and flag patients at risk before the clinician even thinks to look. The result: more bandwidth for the part of medicine that can never be automated, the human connection. The review also maps AI's role on the patient side, where the potential for equity transformation becomes real. Personalized health coaching is enabling self-management at scale, helping patients with chronic disease track their health between visits. These self-directed tools provide real-world findings. Patients feel more empowered when AI provides immediate lay language guidance and 24/7 support. This isn't just triage, it's sophisticated diagnostic aid, dismantling barriers like health literacy and reaching teens around the clock. What makes this review powerful is its framework, seen here. It evaluates AI against the full architecture of healthcare, from patient-centered care and provider experience at the core, to safety, efficiency, and ultimately planetary health. Primary care must be accessible and continuous, and AI must be measured against all of it. But the paper warns, AI can deepen disparities. Datasets used for training often reflect historical inequities. Algorithms trained on biased data produce biased outputs. The review calls for active bias mitigation and equitable implementation. The voices of those most likely to be left behind must be part of the design process from the very beginning. We are at an inflection point. The question is no longer whether AI will reshape primary care. It already is. The question is whether we shape that transformation with wisdom, building systems accountable to the communities they serve. The crossroads is now. This is the work. This is the moment. Stay vital.